Welcome to this Morning On Asakhe podcast, your daily dose of insightful conversation on current affairs, politics, and social issues. Please share and also follow us on social media at SiteZW. Now, stay tuned to today's episode.
A very good morning to you and welcome to this Morning on Asakhe. My name is Nonhlanhla Mabigwa and of course I'm here with Brighton.
It's nice to have you guys back on board today. Hope you guys are well. Today I want to look at the issue of alcohol, drugs and substance abuse amongst teens. What is to be done with this thing has been spiraling and going like on the high in terms of young people using drugs. You know, I was interviewing one counselor in the previous days and weeks. One counselor from Luvepe, she said to me, sometimes by a sticker isn't thin. Mm-hmm. And they jumpstart them using sugar. I was shocked. And again, I spoke to Councillor Tandiwe from Kokoba areas there. She was saying the issues of alcohol and drug abuse. Sometimes they are old people who are selling these drugs in the form of sweets outside school premises. For me, I find it shocking to say, Umzali can do that and sell sweets with drugs. Clothes, what are we doing to our teenagers? What are we doing to our students there?
And as you mentioned these examples, I'm wondering to what extent has this gone to in terms of our children and even our peers as well as, just everyone in the community. The question this morning is what can be done? And here we are looking for short-term and long-term solutions to that.
Let's move on to our first speaker. Good morning to you, Njabulo.
Good morning, Brighton and Nonhlanhla. We need to form organizations that are going to raise awareness. That's the only way you can tackle drugs and substance abuse. Why am I saying that? Because even if you were to tell yourself, Brighton, that you are going to arrest everyone who sells drugs, people are going to still find things to abuse. Because interest dagayo, they are everywhere. They are there in your coffee mixtures. You know, here in South Africa, during the time of the lockdown, we had problems of people that were drinking but in the hand sanitizer, because the hand sanitizer had 70% alcohol. So as alcohol was closed, people buy hand sanitizer and drink them. And mind you, hand sanitizers have substance which is not edible in them. Some of the substance which was poisonous, they will still drink. You don't need to necessarily be going after the dealers. You need to start pre-rehabilitation whereby you deal with them as they are young. You start going to schools and raise awareness.
But how did you get here? So, do you know what? In the past year, 2023, 2022, in the past years, you've seen the spiraling of this alcohol and substance abuse. It's cancer. How did you get here? Is it the coping mechanism for young people? Is it the issue of unemployment? Is it depression? How did you get here to say you have these cases of young people using alcohol and abusing drugs as well? Good morning to you, Namato.
So the thing that we have seen, Brighton, for me, it's literally the boredom that is there within a society and the lack of having systems and institute that makes people to be able to self-actualize. I mean, it's just a normal, as for a human being, market to school, and let's say you get to work and you start to work or you run a business, whatnot. It's normal to say, okay, I have to dream to get a house. I have to dream to buy a car. I have to dream to get it's a dream to, okay, I will get married. I will have children. I will support my family and stuff. But when those particular first elements are not met, it actually results in boredom and then hence drugs and whatnot. And the funny thing is that it's not just with our peers, but also the elder people. If we look at one point it was Mzepete, Nyawupe, and all the others. Before the Nyawupe and stuff, it was Mzepete, Totot and whatnot. So if we look at our community, could need that prevalence of boredom and our societal, what government is supposed to support in society. They've actually removed that and they've just gained and they're just gaining and stuff. And I think it's something that we as a community have to sit down really and look at Uguti. How best can we have the business people around to be able to come to these vocational places and inject finances where they can inject skills or inject resources. And when government comes in, how can we then barricade and control that the government supports more than it destroys. That's my 2 cents for the morning. Thank you, Brighton.
Oh, thanks so much, Mnamati, for that. Quite interesting what you are raising there. But also, guys, what is to be done? We've been speaking about this alcohol and drug abuse. We know people are selling this in communities. We have seen young people buying alcohol in our bars, underage young people. What is to be done now going forward? If I see them in a bar, what should I do? Drag them outside? What should I do if I see them in the supermarket? What is to be done in terms of our law enforcement agencies, ZRP, and other stakeholders? Let's go to Nkala. Good morning to you, Nkala.
Good morning to Site and everyone. It's something that needs us to look at something that I would say leadership. It's not that it's something that is easy to deal with, that is a fact. But what needs to be done is, when I say leadership, it is understanding how to craft a society around people. Firstly, what lacks first is the understanding of what needs to be done, the roles of leadership. We have actually abdicated in the roles of leadership. Number one, as parents. Number two, as a society, because now we live to compete. We do not live to actually see betterment. So it's quite a lot of complex issues that come in there. And then also, as you were saying also, the regulatory authorities on government side, which is still leadership. So the most important thing is the framework of our society, or where we live, is very important, because it influences the children around us. As they grow into teens, it's a time of experience, it's a time where they try everything. But it is because in the environment around, there isn't anything that actually attracts them to anything important. And when we talk about society, we're even talking about the churches. We're even talking about the traditional leadership. We're even talking about generally the parents and the families around. How do we relate? It's essential to rebuild our societies, because right now we're very much broken societies. Put aside certain things and also make sure that the structure and fiber of our society and communities is actually upheld, to actually make sure that we have a setup of building future leaders. Thank you.
Well, thank you so much, Nkala. You know, this issue of drugs is not only in Toyama town, but also deep down there in the rural areas. Drugs have found their way there, and they are destroying our teens. Bashona, good morning.
Morning, North and Brighton. The problem which we are facing right now is the political will. The members of parliament that we are having, they don't have appetite to come up with a law that can make someone having a thorough and a good punishment that can send a good signal within society. If you go to Dubai, Singapore, Malaysia today, you make sure to find a law that persecutes or prosecutes that individual who is found in possession or taking drugs. Because drugs right now, it's not killing the individual who is consuming, but it's killing a society. It's killing generations and generations. But the solution, in my view, if the parliament step in, if the members of council, or in this sense, councillors and the municipalities come up with laws, bylaws that can, used by us within the communities, I think that would be the closing chapter to this issue that we are discussing. But as it is, there's so many loopholes. By now, we shouldn't even discussing about this. We've got so many people who have been coming on these platforms, questioning them about the issue of drugs. How are they going to fight the issue of drugs? But ever since they got into parliament, into council, if they ever come back and tell us that no, we've raised the issue of this issue of the drug abuse, none of them, because they're enjoying the comfort of being in a room which has got air conditioning and so forth. Thank you very much.
Thank you very much, Bashona, for that contribution this morning.
Let's go through some of the comments coming through from our WhatsApp platform this morning. Nondoma Bena says, our drugs are totally sensitive. I think stopping drugs and substance abuse requires a comprehensive approach that involves preventive education programs, access to counseling services, community support, and enforcement of laws and regulations, especially enforcement of laws. Unfortunately, it seems people who deal in drugs are untouchable or above the laws of the land. and then Tumbano, what Lapana Tanyama drugs, but nothing is being done. Even councillors know what Lapana, this is what's happening, but no one is being arrested. Even if they are arrested, they are released. So now are we pushing profits over morals? We're seeing the decay of our society, our teens, man. Where are we going to get our future leaders? Good morning to you, Mandaza Douglas.
Good morning, Said. Good morning, Brighton and Nonhlanhla. Speaking of which, I think I mentioned this yesterday about the house in Gwabalanda, that the MP was literally powerless to be able to stop these guys. And every time she reports the issue to about the house in Gwabalanda, near Wu 60 there, nothing was happening to these young people. So including when I was at my mother's funeral, I asked one of the young person that I've heard that they were actually dealing drugs, and they were the runners for this particular household. I asked, can you get me some cocaine? And he's like, he went back, and then he came back after a few minutes. He goes, hey, I can get you for $60. So I'm like, so it's true that you're actually dealing in cocaine. So I caught him pens down. The other issue that we're having is that while I'm talking about while I was at my mother's funeral there 2 years ago, so you got the same issue that you've got bottle shop selling liquor opening up earlier on before the shop that sells bread and the basic stuff opens up. And then you're just thinking, how does a shop that sells liquor opens up at 7 a.m. and then the other shop that sells bread for the kids to go to school with is opening around 8, 9 o'clock in the morning? And I'm just thinking, our moral in the society have gone down. During the Timothy stamps, we used to have every bottle store was supposed to open after 4 p.m. That's when they start selling the alcohol. Now you've got these cheap substances like tumbwa, or it is called tumbwa, or whatever that is called, that makes people sick. I tested a lidful and put it in my mouth. It's like methylated spirit that you're actually drinking there. So you've got like methylated spirit that you're drinking there. And the government is allowing those things to come in. Cheap products, keep them drunk, and then they won't revolt or do anything. Thank you.
Thank you so much, Amanda Douglas. Feziwe, over to you.
Thank you, host. This drug abuse issue is cutting across classes, so to say, in Zimbabwe. It's cutting across races. It's cutting across ages. So you find that I get to know of information about people who are like in their late 40s, who seem properly employed, but then they are battling with drugs behind the scenes. And I get to know of people I grew up with who seem to be quite well off and were sent to good schools, and they seem to be doing well financially, but they are now struggling with drugs, and another one is now even straying in the streets. So I also heard from my parents, especially my mother, who now has created a group with former neighbors, some other mothers her age, and so that they could support each other through this, because either the other, one in two of them has a child affected with this situation. So what I wanted to just say is that when we look at this issue, we see that it seems to specifically not just be an age issue where you say, it's the youth, but it seems to be a Zimbabwean issue at this point. And I think if we really want to solve this, we have to address the elephant in the room, which is the leadership. And because the holistic approach to this would be clamp down on the borders to cut the supply, clamp down on the suppliers, and also social development. So we need actual proper rehabilitation centers. We need infrastructural development so that the youth have something to do, and the economy has to go up. So I think in the end, Zimbabweans are suffering from extreme stress from the Zimbabwean situation. And even if you rehabilitate someone, you can't then rehabilitate them and send them back into the environment that caused them to get to this addiction. In conclusion, I would like to close off with a quote from Dr. Gabor Mate. He says, the question should not be why the addiction, but why the pain. So what's the pain? Thank you.
Wow, thank you so much, Fezue, for that contribution.
We've come to the end of the show for this morning. Hope you guys enjoyed the show and we continue to make these conversations around the issues of alcohol and drug abuse. Thanks so much, guys, for tuning in this morning.
Otherwise, from myself, Nonhlanhla Mapigwa,
and Brighton Ngube,
it's bye for now.
Thank you for tuning in to this episode. For feedback, you can contact us on 263-777-470017. Don't forget to follow and like our social media pages.